is Catherine Thompson, and I'm a professor at the University of New England College of Osteopathic Medicine. I've been there for 31 or 2 years. I teach nutrition and biochemistry, and I'm one of the advocates for integrated case-based education. So that's my passion in terms of work life. And I was diagnosed with cancer when I was 57. I found a lump in my breast and went and had a biopsy, and I got the news back from the doctor that it was infiltrating ductal carcinoma. I think that's what it was.
It was interesting when we sort of set out to try to build a support system for her. Your first instinct is to, like, well, do you want to talk about it? Like, I want to be a forum for you to talk about this, or do we not talk about it because I don't want to be, bringing you down about this, or, making you concentrate on negative things. And at one point she just said, I just want to be able to have the right to be angry about this.
Before the surgery, they thought it was small enough that I would be able to just have it removed and then have radiation. And I had to have the surgery twice because the first time they didn't get adequate margins. They were way more advocates of pain relief than I was even. I mean, they were like, you gotta take this right away, don't let it get ahead of you. And I did what they told me. And then the second time, I knew it wasn't gonna be that bad, so I used less of the narcotics because they have such horrible side effects. I walked the whole time. She said, you can walk, but you can't walk fast enough to get your heart beating fast. So the third day after the surgery, I was back on the beach with my dogs. I would start to walk a little bit fast and I would get pain. So I just walked slowly. We dawdled up and down the beach, but I went every day, which I think is really important for pain and just fatigue, the whole thing. It really kept me mentally in a better place. So then we had to do the chemo. What I had was Cytoxin and Taxotere.
Myself and her daughter accompanied her on every trip for the chemo. And the oncologist agreed. We don't know if you even needed radiation therapy or even needed chemotherapy. You just don't know. You just give whatever support you can give. That's what you do.
They warn you the first time you have chemo, they don't know how you're going to react to it. And I started getting real intense GI pain, and it was horrible. It felt like someone was driving a stake into my belly. I was in a lot of pain, so I called up they give you a helpline to call. And I got the doctor on call and explained to him that I was in this intense pain again and I'd been in the ER. And he said, well, do you still have narcotics left from your surgery? And I said, yeah. And he said, well, take some of those. And at that point, and it's because I know stuff, I thought, if peristalsis isn't occurring, the last thing in the world I want to take is a narcotic, because that's just going to stop everything even worse. And I was just pacing because I couldn't sit down. So I just paced around the room and kept trying to drink this ginger tea, thinking in my head, this is just something that's blocked. If I can just get things to peristalsis to start going, I'll be okay. And I actually felt it. At one point, like, I drank a sip of the ginger tea and then I could just feel the pain release. The other thing about chemo is you're gonna lose your hair. I was in front of the mirror, skinning my hair back, trying to see what I would look like, and I didn't like it at all. And prior to the chemo, I had investigated not losing your hair, and I looked it up, and the theory behind it makes sense. If you can make the scalp really cold, you do two things. You decrease the blood flow to the scalp so less chemotoxic agents get there, and you slow the metabolism of the hair cells so that they're not going to take up the chemotherapy.
It was a complex process. We had a bunch of these caps. We would keep them in the dry ice, and then we would put a cap on her while she was having the chemotherapy, while she was intubated. It was just that we were kind of making do, the best we could with what we had. you know, like they say in Maine, all you need is WD-40 and duct tape and you can fix anything. Well, that's kind of the approach we took.
The caps are really, really cold. Minus 30 degrees centigrade is cold, and it hurts. It does hurt, but I did not lose my hair. It did work. So I looked normal, which was a big deal. The whole environment at the university is very supportive and positive. They let me do what I needed to do, and they were there for me.
The fact, I think, that it hasn't relapsed and that we're now 5 years out from the initial diagnosis is, it's sort of like out of sight, out of mind a little bit, and it helps you, you know, you just snap back into your normal life again and you almost don't miss a step.
My cancers were hormone positive, so I'm on an ongoing treatment of, it's an aromatase inhibitor, which decreases your body's production of estrogen because the tumor was estrogen positive. It's pretty awful. I don't want to do it again. Even though, you know, for me, it was as good as it could be, but I don't want to go back there.